Hi, I'm Dr. Scott Morris. I'm the founder and CEO of Church Health, and I can't believe that I'm not here tonight in person for the Serving the Underserved course. It's something that I care deeply about, as does all of Church Health. But I'm glad to have this opportunity to talk a little bit about why we do it, and really about the work and mission of Church Health and how we are hoping to inspire all of you who are out there to want to do similar work at some point. So let me just begin by telling my own story and how I got involved. So I actually grew up in Atlanta, and growing up in Atlanta was always interested in the church, and the idea of being professionally involved and caring about my faith mattered deeply to me. But the thought of preaching 52 sermons a year sent shivers down my spine, still does. I have no idea how anybody could do that. But as a teenager, I read the Bible and came to realize that a third of the Bible has to do with healing the sick. It's literally on every page. But I would look around to see what my church or what other faith traditions did, and I just wasn't very impressed. There wasn't much to it. We prayed for people, we visited people in the hospital. All over the country, we had built large hospitals that have church names on them. They do good work, but they literally had almost nothing to do with worshiping congregations. It seemed to me that there ought to be more to it than that. So I go to college, I go to seminary. I spent most of my time in seminary looking at what the church has historically done and came to realize there's a reason these hospitals have church names on them. We just forgot. I'm not going to give you a long song and dance history lesson, but if we look just at this country, prior to the Civil War, if you were sick, the most likely person anybody would have seen for healthcare in America was actually a pastor. Pastors provided virtually all the healthcare in this country. Just one person to tell you about is John Wesley, who's the founder of the Methodist Church. Wesley actually thought every Methodist society, indeed every church, should be involved in direct, hands-on healthcare. Wesley actually wrote a book called Primitive Physics, which was so successful in the American frontier that as late as 1850, if we were in Memphis in 1850, there would have been a greater chance that you would have had a copy of Wesley's book, Primitive Physics, than you would your own copy of the Bible. Now, I fully confess Wesley had some unusual ideas. He had at least 18 different cures for baldness, most of which I've tried myself that didn't really work. But really more to the point, Wesley believed that every Methodist society and every church should, again, be involved in direct hands-on healthcare. For Wesley, it mostly had to do with the coal miners of Western England. But when he came to America, even though he was not a very successful evangelist, his ideas around healthcare actually caught on. Until as late as 1863, a pastor in Guilford, Connecticut, wrote the standard textbook of physiology. Now, things are clearly not that way today, right? That things have changed. Part of what we need to understand is, how did we get to have these hospitals that have church names on them? Well, around the turn of the 20th century, there was something called the social gospel movement, started by a guy named Walter Rauschenbusch, who believed, along with so many other people, that all the new science that had come about in the late 19th century around medicine and healthcare should be available for everybody, including the poor. And as a result, Rauschenbusch and others used the resources of the church and the broader faith community to build hospitals all over America whose primary purpose was so that the underserved, poor people would have access to all the new knowledge. So this is why these hospitals are named Baptist or Methodist or Saint whatever. It's because the intention is that we were going to provide health care as best as possible for the poor. Now, things changed for a lot of different complicated reasons. One becomes the fact that medicine becomes a business, becomes very complicated, becomes very expensive, and yet the reality is that so many people are working and yet uninsured. So I end up going to medical school after seminary. I then do a residency to be a family doctor. Along the way, I, in the Yale Medical School, encountered a little pamphlet called How to Start a Church-Based Health Clinic. And I go, that's it. That's what I want to do. And then I'm finally ready to start my own church-based health clinic. I wanted to stay in the South. I didn't want to go back to Atlanta. And then, not making this up, I read somewhere that Memphis was the poorest major city in America. And based on that, I said I was going to Memphis. At that point, I was 33 years old. I was too young, too dumb to realize that what I wanted to do had no chance to succeed. So one of the reasons I tell you that part of the story is that, I believe that some of you may have your equally crazy ideas about how you want to go make a difference. And yet people are going to tell you right and left that it'll never happen. It can't possibly work. It's too ambitious. Just look at the story of Church Health and go, they were able to do it. Maybe I can too. Now, our focus when we opened in 1987 was to provide care for the people who work to make our lives comfortable. Things have not changed over the last 35 years. So we take care of the people who cut our grass, wash our dishes, take care of our children, will one day dig our graves. They don't complain. Yet when they get sick, their options are very few. In 1987, there were 26 million uninsured Americans. That number grew to over 50 million. And today, even with the Affordable Care Act, that number is almost 27 million, more than there were when Church Health began in 1987, plus the immigrants. Nobody counts the immigrants. If you are working and you've been in Memphis for 20 years building a house and you fall off the roof and break your leg, what are you supposed to do? Even back when Bernie Sanders advocated Medicare for all, Medicare for all didn't actually mean Medicare for all. It only meant people if you were native born and you at least had a green card. Otherwise, the plan would be to go back to Mexico. Well, I don't think that is how it should be. If somebody in that situation comes to me and God puts them in front of us, I want to say we did the best we could possibly do. That is what how Church Health has really focused all these years. Now, when you think about the underserved, it's not just about giving them pills. One thing we need to be crystal clear about is that all pills are poisons. That's how they work. They poison your body from doing something it is naturally trying to do. You got to be pretty doggone smart to override the body the way God created it. Thank God the pills don't always do what they tell us they would do on TV. If that were the case, we'd be killing people right and left, which is unfortunately all too true. So how Church Health thinks about it and how I hope you'll think about it too is that being healthy is not about the absence of disease. The World Health Organization will agree with that. Who cares if you live 2 years longer if it means 2 years longer in a nursing home? Life for life's sake can't possibly be the point. Breathing in, breathing out, none of us are signing up for that. So what we think being healthy is about is ultimately 3 things: having more joy in your life, having more love in your life, and being driven closer to those things greater than we are. Now, we would call that God. You don't have to call that God. But for all of us, there are things greater than we are we need to be drawn closer to. Now, if this is what it takes to be healthy, more joy, more love, and being driven closer to God, it doesn't have a lot to do with the doctor, which is what led us to create what we call the model for healthy living. This is just a riff on the social determinants, but we think there are 7 things in life that are equally important in order for us to be healthy. So one is medical care, but it's only one. I think all of y'all know by now that only 10% of anybody's health outcomes has anything to do with the doctor, the hospital, or drugs. 10%, that's it. That our country is spending $1 trillion a year on those 3 things. I think you should argue that we're not spending the money very wisely. There are other things that are equally important that matter in order for us to be healthy. Now, the next is nutrition. Your mother told you are what you eat. She was right. Movement. Our bodies were made to move. Emotions, family and friends, work. We define work as those things that bring meaning to your life. And lastly, your faith life. Your faith life is as important as anything the doctor would do if you're going to be healthy. Now, we're not advocating you evangelizing patients, or nobody wants to have the doctor or nurse or physical therapist or dentist impose their belief system on them. But it's been shown over and over again that patients do want to be able to talk to their healthcare provider about their own faith issues, and the issues of spirituality matter for that person to be healthy. So we hope you will learn how to do that as time goes on. It's something Church Health cares deeply about. So this idea drives all of the work of Church Health. It is also part of how we can think about serving the underserved as being more than just finding a way to pay for technology and pay for drugs. Unfortunately, in our healthcare system, we have developed an unholy love affair with technology. We've come to believe that people can live any way they want to, and it doesn't matter, because when they're broken, the doctor could use that technology to fix them. Well, I hope you have learned so far in your training that the technology is not that good and the doctor is not that smart. God gave us this body for a reason, and we have an obligation to take care of it. So I think this is a very important part of what serving the underserved is all about. We need to help people understand the reality of what it means to live a healthy life. Nutrition being an important part of that. Yet, one of the things we are challenged with is the philosophical concepts of Plato and Descartes. Both Plato and Descartes, 17th century French philosopher, convinced us that we can take a human being and separate us into a body and a spirit. And we have put the body on one side and said it's the purview of science and medicine. We put the spirit on the other, said it's okay for the church and people of faith to mess around with our spirits, but heaven forbid we cross that line and care about our bodies. But this idea known as Cartesian dualism is fundamentally flawed. It is a non-Christian, non-Jewish, non-Muslim, non-Hindu idea. Every world religion completely rejects this idea that the reality is that we are dust and breath. We are body and spirit. And we must care for our bodies as well as our spirits if we're going to be whole. In your training, never forget that there is a spiritual dimension to life. And look, all of your testing is going to be built around, do you know that the knee bone is connected to the thigh bone? And can you pick that out on a multiple choice test? But the reality is that human life is much more complicated than that. And that is especially true among the poor. One of the great things in my life has been my ability to be engaged with people who truly have nothing, who have taught me a great deal about the important things in life. Over the years, I have seen many, many people who are older, who may have grown up even picking cotton, who lived a very difficult life from their work standpoint physically. Economically, they have very little. And yet when I will walk into their room and ask them, how are you doing? The answer I invariably get will be, I am fine and blessed. Really, you're fine and blessed. You have nothing. How can you be fine and blessed? Because economically, the way America views it is you have no capital. Well, what they do have is an abundance of spiritual capital. And what I've been able to learn from them over, and I hope you will do as well, is what does it mean to have that kind of spiritual wealth? And I get a chance to spend the first few minutes of my visit with them making sure that medically I'm not messing up. And then I get to, with the last few minutes, be able to ask the question, how do I get to be fine and blessed? What do you know about life that I need to know? I think that is one of the most important experiences I have had over the last 35 years at Church Health. And I hope you will start now to develop a way to engage patients in a similar way. Now, serving the underserved is very difficult, and it can lead to burnout in a lot of different ways. I also believe that the nature of our healthcare system will push you in a way that is counterproductive to caring for people who are fine and blessed. You know, our system is broken in so many ways, partly because of our mechanistic understanding of what we are about to do. So I tell a story every year, but I want to tell it one more time, which is when I was a third-year medical student at Emory in Atlanta, I was part of a team that was called in to do CPR on somebody who had arrested. It was an older man. He was very poor. But I was doing the chest compressions, which was the role of the third-year student at the time. And the team was doing everything we were supposed to be doing. And then the senior resident came in and asked the question, hey guys, when this is all over, where are we going for pizza? And I found myself thinking, did I want pepperoni? At that point, I was about to go over into the abyss. And I pulled myself back because I came to remember and realize that this was a real human being whose life was underneath my hands. I'm begging you not to be converted to what I call the religion of medicine, which is what this is all about. It's also really important, if you want to serve the underserved, to find a way to be connected to your patients in ways that are not just about their disease, their diagnosis, and the test that they just recently had. Also, as a medical student, we were on rounds, and another medical student with me was making a presentation and began her presentation talking in great detail about the patient's life. All very important, I believe. Only at one point, the attending called her out and said, young lady, I think you have gotten too close to your patient. Look, the reality is you cannot get too close to patients. There is a way that we all have to find a way to be engaged in people as human beings. The fact of the matter is, it is natural for us to keep a distance from another human being. We don't have to be taught how to do that. But what you have to learn how to do is how to draw close to somebody else. That actually does not come naturally. Yet medicine tends to push us in the opposite direction. And the more you're engaged with your patient, and especially people who are underserved or who are poor, the greater it will be in your own life, but it will also help you create a dynamic that provides better ability for you to actually care for people. Now, there's so many other issues here that we're going to talk about through serving the underserved. Just realize the economics of this are brutal. The Affordable Care Act was intended in order to expand Medicaid so that poor people would have access to an ability to pay for their healthcare systems. But unfortunately, the Supreme Court allowed for the state of Tennessee and Mississippi to not expand Medicaid, so it's not available to our patients. You might say, well, they can go to the exchange, but the exchange only allows people whose income are above 138% of the poverty level. not below, above. So that means of the 80,000 people who Church Health takes care of, more than 90% of them, if they go to healthcare.gov, they are told that they don't qualify. It is not possible for them to get any type of subsidy to buy health insurance in the open market. You know, what that means is that the poorest people get nothing. Nothing. You know, Jesus said the poor will always be with you. So far, he's been right. I just don't think he ever thought there were going to be so many poor people. So look, this is going to be a transformative experience with you in this class if you let it. I hope you will get engaged in this type of work. Church Health will be here for you. You're going to meet a lot of folks over these 4 weeks that are doing the work. There's many different paths to be able to caring for the uninsured. You need to find your way. And Church Health will be here for you if you want to be inspired. I hope some of you will ultimately decide that after you finish your training, you want to come back and work with us. It's a great place to work, and we wish you only the best.